Chapter 7. The Single-Payer Solution, an Evidence-Based Prescription. Confronted with the overwhelming evidence of a corrupted system, the solution is not more incremental tweaks, but a fundamental reorientation toward health as a public good. A single-payer system is the most efficient, equitable, and logical alternative. The overwhelming economic and health case. The evidence from both international comparisons and domestic analysis is clear. 1. Massive cost savings. The United States spends 17.7% of its GDP on healthcare, far more than any other organization for economic cooperation and development country, while achieving worse population health outcomes. A single-payer system could save hundreds of billions of dollars annually by slashing administrative waste and negotiating fair drug and service prices. 2. Administrative efficiency. Countries with single-payer systems operate with dramatically lower administrative costs. In the U.S., a staggering 31% of national health expenditures go to administration, while single-payer systems like Canada's spend a fraction of that. Consolidating the multitude of private insurers into a single, public payer would eliminate an enormous layer of redundant paperwork, billing, and marketing. 3. Guaranteed health equity. A single-payer system establishes healthcare as a human right, guaranteeing universal access to care without financial hardship. It eliminates systemic barriers that disproportionately harm low-income individuals and communities of color, who face higher claim denial rates and worse health outcomes under the current for-profit model. Debunking the myths and overcoming the opposition. The transition to a single-payer system faces formidable political opposition, primarily from the very industries that profit from the status quo. The opposition, insurers, pharmaceutical companies, and some provider groups, represented by powerful lobbies, have massive resources and a clear material interest in opposing single-payer. They argue it would mean higher taxes and less choice. The reality for the public. While polls show initial support for single-payer wanes when respondents hear about potential tax increases, this framing is misleading. The tax would replace all premiums, deductibles, and copays, resulting in net savings for the vast majority of families and businesses. Furthermore, choice is redefined. Patients gain the freedom to choose any provider without worrying about narrow networks or out-of-pocket costs. The U.S. single-payer experience. Critics call single-payer healthcare a radical, unproven idea. The truth is, we already have a successful model here in America, the Department of Veterans Affairs health system. The evidence for VA effectiveness. 1. Superior outcomes. Veterans treated at VA hospitals have shown a 4.5 percentage point higher survival rate at 28 days compared to those treated at private facilities, while costing $2,598 less per episode of care. 2. Integrated care advantage. The VA's electronic health record system allows seamless coordination between primary care, specialists, and mental health services, a stark contrast to the fragmented private system. 3. Preventative focus. The VA's emphasis on preventative care and chronic disease management leads to better long-term health outcomes and lower costs. The political sabotage playbook. Despite its proven effectiveness, the VA faces systematic underfunding and political attacks designed to make public health care appear to fail. 1. Defunding direct care. Recent House bills have directed 75% of new medical funding to private community care, rather than strengthening VA facilities. 2. Staffing cuts. Plans to cut 83,000 jobs while veteran enrollment increases guarantee longer wait times. 3. Manufactured crisis. This deliberate weakening creates a self-fulfilling prophecy where the VA appears broken, justifying further privatization. The VA proves that when you remove the profit motive, you can provide better care for less money. That's why it faces constant political attacks from those who profit from the current system. The evidence is compelling. The single-payer model is not a radical, untested idea. It is the standard in every other developed nation and is proven to provide better care for more people at a lower cost. It is the necessary counteroffensive to the hostile takeover, a democratic reclamation of a system that should serve people, not profit. The evidence is undeniable. A single-payer system would save lives, save money, and guarantee health care as a right. Yet, the system persists, protected not by merit, but by profit and political power. So, how do we break through? This forces us to ask the critical, final question. If the solution is so clear, what's stopping us? And what must we do to win? This leads us to our next chapter. Chapter 8, Reclaiming Our Health, a Counter-Offensive.